Hi guys, today I came up with a new topic called nursing care plan. I think you have seen my last video that there was an important baseline topic that is very essential in our nursing life as well as the profession. So that was a nursing diagnosis, and you can correlate with the last video to the here. So if you are new to my channel, just go to the last video and see what is nursing diagnosis and then come to the nursing care plan. Because without nursing diagnosis, there is no nursing care plan. So as I said earlier, for everything there will be an association that will guide. Here in nursing diagnosis and nursing care plan, there is an association that are helpful in guiding and that are interested in standardizing these nursing terminologies, care plan as well as the nursing diagnosis. That association is called NANDA. About NANDA, everything which was completely described in the last video, you can go through in that. And again, by keeping the nursing diagnosis from the last video, which have listed more than 5 to 6 nursing diagnoses, by keeping those prioritized nursing diagnoses, we are implementing in this nursing care plan. So what is nursing care plan? Let's see the definition. So according to Nanda, nursing care plan is a process of nursing care that includes the 5 components. Okay, mainly it includes 5 components consisting that we are going to see in the later. Firstly, the component 1, that is the assessment. Assessment part includes 2 data. One is the subjective data and another is the objective data. And the second component is objective or the goal, and third component is nursing intervention, and the fourth is nursing implementation, and fifth is the evaluation. So this is what the association tried to come out with. Nursing care plan is nothing but the components that includes these 5 components of nursing process and care is called the nursing care plan. Okay, so let's see each component one by one. First one, the assessment. How do we fill the care plan? See, firstly, we have to mention 5 to 6 prioritized nursing diagnoses. Followed by that, a care plan should be there. So whenever you appear to the exam or any competitive exam or institutional exam or your theoretical exam, whatever it may be, first list prioritized nursing diagnoses which I have mentioned in the last videos in each system wise, and then come to the nursing care plan which we are going to discuss now. The assessment includes the subjective data and the objective data. It has to be divided in 5 compartments. Okay, subjective data. Here itself it says clearly that subjective is what we or what the patient says. Okay, it is completely depends on the patient. Subjective data is nothing but the conversation or the feel that patient expresses or conveys. Okay, and what is objective data? Objective data is nothing but the nurse, he or she, what observes. Okay, let's take an example. Let's take a single example. If required, we'll go to another. So first example that we are going to look for is respiratory system, which is an important and prioritized one. Ineffective breathing pattern related to excessive secretions as evidenced by either it may be wheezing, coughing or dyspnea. Dyspnea is nothing but a difficulty in breathing. Okay, so this is the nursing diagnosis. You can divide it in 3 compartments. Here you can see a problem, etiology and signs and symptoms. To know more, you can see the last video. By keeping this nursing diagnosis, here the problem is ineffective breathing pattern. The patient has ineffective breathing pattern. By keeping that while nursing assessment, see, completely the assessment part will be a nursing part. We have to take part in that and we have to assess for it. Subjective data. Here the patient will be saying in this example, patient will be saying, I am not able to breathe. You have to write exactly what patient says. Start with the inverted commas and end with the inverted commas. Here, if patient says, I am not able to breathe, write exactly what patient says. Do not manipulate here, or else if you manipulate, you will lose your marks. And next will be the objective data. This will be our part. Subjective will be the patient's part and objective will be our part. Objective data. Here you have to look for the signs and symptoms, or you have to assess observably on observation what you are assessing. Here what you have to write is, on observation, patient feels discomfort and he feels difficulty in breathing. Okay, this is what you have to write in objective data. Now I hope you are clear with the assessment, that is subjective data as well as the objective data. Now the second component. As I said earlier, the second component will be the nursing diagnosis. The nursing diagnosis here is, which we have discussed earlier, that the respiratory system, ineffective breathing pattern related to excessive secretion as evidenced by coughing, wheezing, or it may be dyspnea as well. Now this part is completed. Now we will move to the third component. Third component is objective or goal. It clearly states that objective or goal is nothing but an aim. What you are aiming at your end of the care of the patient. Okay. Now let's take this, since this is a respiratory pattern or respiratory system, you are going to look for a breathing pattern that has to be improved in the patient. So now what you are going to write in the third component or the third compartment? Here you have to write in the future tense. Always make a note here. The third component, the objective or a goal should be in the future tense. Let's say what you are going to write is breathing pattern to be improved or breathing pattern will be improved. This is what you are going to write. Always it should be in the future tense when it comes to the goal or the objective, because you are aiming it. So at the end of your care, you are expecting the goal or objective always will be the expectation. Okay, so this is what you are going to write in the third component or the compartment. And let's move to the fourth now. What is the fourth component of the nursing care plan? The fourth component is nursing interventions, which plays a vital role in this nursing care plan. So if you are writing in the theoretical exam or the papers, definitely it will play a major role. So let's say you are writing few points. Other than the nursing interventions, you are writing all the tabular column with all 5 topics, with all 5 components, whatever it may be, but you are left out with the nursing interventions. But the examiner will think you are no way to evaluate your paper. Okay, always it matters the nursing interventions, which is very crucial or very important in nursing care plan. Whatever these points are like 0.5, 0.1, 1 marks, 2 marks. But the nursing intervention will take your all entire marks. So always concentrate on the nursing interventions and give some importance to the other tabular columns as well. So now let's see what the interventions, the nursing interventions that you will be writing for this example. The first thing, I will give you 4 to 5 important tips so that you can follow in your exam paper. First thing, the assessment. And the second thing, the position. Third thing, monitoring the vital signs. And fourth will be your other interventions. If you follow these 4 tips, definitely you can fill your exam page like simply taking a piece of cake. Okay, so don't worry, the nursing interventions are as simple as that, but it varies according to the system wise. Since we are dealing now with the respiratory system, the first point goes to the assessment, that is assess the respiratory sounds or breathing pattern or auscultation sounds or whatever it may be. So first point what you will be writing in nursing intervention is assess the breathing pattern or assess the auscultation sounds or assess the respiratory sounds or rate. You can write the respiratory rate as well here. And second point, as I said earlier, will be the positioning. Positioning will go the second point in nursing intervention. how you will position the patient in respiratory issues. You have to position the patient in upright position. So you will be writing in exam as provide comfortable position with folders or semi-folders position. Always don't write the comfortable position. Instead, you mention the specific word, either the folders or semi-folders position. Folders is nothing but the 90-degree, and which is lesser than is said to be a semi-folders position. And third point will goes to the monitor the vital signs. Okay, this will be your third point. Monitor vital signs. Since here it is a respiratory pattern, you have to give more importance to the respiratory rate. And the final thing, that is the fourth point, is other interventions. Here you can write any intervention that you are willing to write. These three should come in the first 3 points so that you can gain more marks when it comes to your theoretical paper. The fourth point is other interventions. What are all the points that you can include in any system is provide diversional therapy, provide musical therapy, provide recreational therapy, or provide psychological support and emotional support. These are all the points you can include in other interventions. Make a point, these three should be very mandatory and it varies according to the system wise. But the fourth point you can, but this doesn't matter a lot. This will be for your namesake of page filling. But though you give to the patient or what are the care that you provide to the patient, you can enter no matter what these points are. And next we'll move to the fourth compartment, that is the nursing implementation. This will be the implementing part. Okay, how I said that objective or goal will be the future tense, the exact same way the nursing implementation should be in the past tense, because the nursing intervention is what you're going to enact or provide the care to the patient at present tense. That has to be in the future, the past tense when it comes to the nursing implementation, because if you use a assess here in the nursing implementation, it should be the assessed. You have to add ed. This is where you have to make a note, because when it comes to the theoretical paper, don't ever use ed or this part itself. Whenever it comes to the theoretical paper, better skip the nursing implementation part, because there is no patient in front of you to write in exam papers. But it has to be used in the clinical side, but not in the theoretical side. So make a note or compare yourself whether have to write the nursing implementation part in the theoretical or clinical, that decides with you. If you write the implementation part in exam, definitely they are going to strike out, because without patient, how you can implement your care? You can write theoretical part as nursing intervention, not the implementation. Implementation part will always come in the clinical but not in the theoretical. Okay, hope you are clear with this point. Now I will go with the implementation part. Yeah, now we have discussed the fifth component of nursing care plan, that is the nursing implementation. Make a note here, nursing implementation should not be used in the theoretical area, whereas it has to be used in the clinical sector. Okay, when you appear into the exams, don't write the fifth component, that is the nursing implementation part, in your exam paper. In clinical side, it is must and should, because evaluation part takes a major role in clinical side. So the fourth component will be the nursing intervention in both places. Okay, but in clinical side, nursing implementation will be the fifth part. Hope now you are clear. Now let's start what all the points that you have to write in the fifth component of nursing implementation, that is in the nursing care plan, is nursing implementation. The first part will be the assessment. In nursing intervention, you have written assess the breathing pattern. Here it will be as ed part, which will be the past tense, assessed. Okay, assess, here it will be assessed. This part will be in the clinical sector, that is clinical settings only, not for the theoretical area. This nursing implementation part will never come in the theoretical area. Second, position the client in appropriate position. Here, positioned the client in appropriate position, or provided semi-folders position, provided Folus position, provided upright position. Add ed, whatever you write in intervention part, add ed to the implementation part. Okay, this is what will take part in these two compartments. And third part, what we have discussed here in intervention part is the monitor vital signs. Here you have to write monitored the vital signs and mention the values. Okay, here if you have mentioned in the intervention part, that's fine, then don't write in the implementation part. And finally, the other interventions what we have discussed in the intervention part should be all written in ED. Okay, provided diversional therapy, provided emotional support, provided psychological support, provided musical therapy, provided recreational therapy. All things should be added with ED, which represents the past tense when compared to the nursing intervention part. Hope now you are cleared with nursing intervention and nursing implementation, right? And finally, the sixth compartment is the evaluation part. This also plays a major role because evaluation will be the evidence based. How we have discussed the PES format that the signs and symptoms is an evidence, here the evaluation part will be the evidence. Okay, now let's see what you are going to enter in the evaluation part. Let's say with this example, what you are going to write is breathing pattern to be improved, what we have written in the objective part. But here breathing pattern has improved, or breathing pattern had improved, or else breathing pattern is improved. These all three past tense you can write in the evaluation part. Breathing pattern is improved, or breathing pattern improved as evidenced by, because this is very important in the evaluation part, that makes you to give an evidence based care that we are following in our modern nursing. Okay, what you are going to write in the evaluation part is breathing pattern is improved as evidenced by what all the patient signs and symptoms has been reduced. Okay, as evidenced by decreased cough, decreased sneezing, or decreased in dyspnea. Okay, decreased in breathing difficulty. These all the things you can write in the evaluation part, because at your end of care, don't write absent or patient doesn't have any symptoms. It may persist, so better you can write decreased cough or decreased sneeze or decreased wheezing and decreased breathing difficulty. So this will be your evaluation part. So now we have discussed all the 5 components of theoretical and 6 components of clinical side of a nursing care plan that you can implement in your papers as well. So if you do have any queries or any questions or any comments, please do chat in the comment box and give support so that I can do more videos and which you are interested for. And finally, I would like to sum up the video, sum up the summary or the topic that we have dealt with. Mainly, the nursing care plan consists of 5 components in the theoretical side and 6 components in the clinical side. First thing is assessment, that includes the subjective data as well as the objective data. And second is the nursing diagnosis, which we have took for today example as respiratory system, which we are already discussed with. And third component will be the objective or goal, and fourth component will be the nursing interventions. These 4 will be similar for both, and the fifth part will be only for the clinical part, that is the nursing implementation part, and finally the 6th part is the evaluation part. Hopefully I gave complete information with one nursing diagnosis that could help you to frame and complete nursing care plan and their nursing processes that could help in treating a patient. So if you write these all 6 points in the clinical paper and all 5 points in the components in your exam paper, definitely you get exact marks what you are expecting for. Hopefully have completed all the components that are included in nursing care plan, which is helpful for you and institutional as well as the clinical side. So hope I am done with my topic and I have completed all points which will be helpful for you people. And thank you guys. Today I am done with the topic. We'll see with the new topic which is very important for your upcoming exams. So stay tuned for the next video. Thank you guys. Bye bye.